This is Because Teeth Podcast with Greg Santiago and Cody Preble. All right, back with another episode.
Episode F today. We're flying through these episodes now.
Yes, sir. So thank you guys for listening first and foremost. Topic of this episode is our guest. We have a guest with us today, Kathy.
Hello.
She is a good friend of mine, first and foremost, and we used to work together at our dental assisting school together and kind of went on a little bit of a dental journey, I guess you can say, together. So it's going to be an interesting episode. She's actually now in the process of applying and, you know, you're going to get in. I hate like doubting it, but getting into dental school. So
hopefully one day.
This is going to be an interesting kind of episode, and we're going to really just kind of dive into her journey and everything like that. The other thing that I wanted to say is, you know, if you guys are listening, this is probably a little bit after Christmas. So hope everyone had a good, you know, holiday, good Christmas. And yeah, I guess let's just kind of dive right into it. Yeah, our giveaway is done at this point. So we can kind of just say that in the beginning of the episode. So might do another one, you know, maybe soon. So other than that, let's just kind of dive right into it. So Kathy, you are in the process of going to dental school, and you can, I guess, just kind of elaborate like where you're at right now, and maybe if you just want to like kind of start like way back, like what got you into dental. I mean, that's always like our biggest like, you know, conversation starter is what got you into dental and what's leading you to dental school and become a dentist, and go from there.
Yeah, of course. So I'm actually currently a dental assisting instructor, and it's actually the school that I went to you know, start dental assisting to begin with. So I guess I'll just start from the way beginning. So I was in university. I was an undergrad. So I always knew I wanted to do healthcare. So I kind of just picked, you know, health sciences and just kind of started with that. I did okay in my classes. I didn't really have a vision, so I kind of just showed up to my classes and, you know.
And we should say we're not recording in our normal studio today.
Yeah, we're actually in a really cool location. We're going to be posting some of these photos and videos. So if you guys hear a little bit of background, you know, noise, we apologize, but it'll probably be very brief. So
yeah, that's how it is. If you're wondering.
But yeah, we actually got a really nice view. We got a waterside view here right now. So this is nice.
We're treating our guests today.
We're definitely treating our guests. So the other thing I want to bring it back. What made you choose healthcare? Like what drew you to that? Was it like, you know, because for me, one of the episodes I talk about, like my mom always told me, like, just no matter what you do with life, just go into healthcare. And that was like kind of my influence and my mindset initially. But what drove you to healthcare, I guess, initially?
Yeah. So my parents kind of said the same thing, like growing up. They were just kind of like, you know, pick a career that is stable, something that, you know, will always be in demand. So I think healthcare is obviously one of those fields. And, you know, so it's something that's stable and makes like okay money, like a stable income. So that's why I chose healthcare, but I didn't even, you know, I didn't know anything about healthcare. I was like, you know, at one point I was like, oh, I'm just going to work in a hospital, maybe be a nurse, something like that. Like I didn't really have any sort of like vision per se.
Like,
I just
like guidance or anything.
Yeah.
Did you have any like family members that were in the healthcare field at all?
Actually, I do not. No, I'm actually a first generation college student. So I was the first person in my family to go to college.
Wow.
University.
You know, it's funny. Me too.
Yeah. So, you know,
weird,
yeah. And so I was an undergrad, you know, they kind of just make you pick a major. So I picked health sciences. It sounded like something that I wanted to do. Like I said, at the time, I didn't really know. So I kind of was gearing more towards like general medicine, like maybe to go to medical school one day. And so again, I wasn't really passionate about it though. So I kind of just went to class, kind of did like the bare minimum, you know, C's get degrees, that kind of thing.
Yeah.
So, you know, I did okay in my classes. I really didn't put in like the time and the work that I probably should have.
Yeah, well, prereqs is always like that.
Yeah.
You know, it's like one of those things, and I think that's with anybody, and especially like with our present day society with social media and, you know, the generations now, like they don't want to go through those prereqs. They start and they're like, no, like I don't need school kind of thing, which nobody enjoys prereqs. And like, you know, I know for me, it took me, like 6-7 years to get all my prereqs done for dental hygiene. Not literally that long, but like my initial thing was to go to dental school. So like I was getting my associates to get a bachelor's kind of thing. And that was my first mindset. But you know, it's like one of those things, you're not going to enjoy your prereqs. And also too, I mean, not for nothing. I mean, I won't say don't remember anything from my prereqs, but don't really utilize much.
No.
It's more of just kind of a what's our word I want, like structure, like, you know, you're getting used to that class situation, that awkward situation, taking tests, exams, that's how I viewed it. I don't know.
And a lot of times when it's at the beginning of your whole like career or field or whatever you're getting into, you're not really focused on those classes. So sometimes those prereqs get overlooked, and that's when you'll get a C or a D, and then it kind of hinders you later on, and you have to retake those classes.
Yeah.
It's just
It
it's
haunts
one of those
you.
things. Exactly.
It's a weird thing, but it does haunt you.
It does.
awkwardly.
It does.
Like you don't
come
think
back
they
to haunt
matter,
you.
but they really can play a role later down the road.
For sure. It happened with me with dental hygiene school. I had to end up retaking one of my maths, and it was weird because with me, I actually like was trying to like be an overachiever, I guess, a little bit, because I started in college algebra, where there's normally I think you have to take like there's something else before college algebra. I forgot what it was, but I had that options. I don't remember what it was. It was something like, it was just a different math.
Okay.
And all you need for hygiene school is college algebra or pre-calc. One of those two, whatever grade you get in, whatever better grade, you use that grade. And I was like, you know what? I'm going to look better. I'm going to start in college algebra because I scored very well on my, I think it was SAT or ACT, whatever it was, in math. So I didn't have to take like or I think it was the entrance test.
Okay.
Anyways, so I was able to start in college algebra, and I went to pre-calc and C'd both of them. And I even knew the teacher, like I'm obviously not gonna say it, but like I knew the teacher in pre-calc, and I was like, yeah, this is gonna be all right. You know what, college algebra I gotta see, like pre-calc, like something's gonna happen here. I'm gonna be okay. You know, I'm gonna get a little slide, a little pass or something like that.
Yeah.
Definitely not the case. He even pushed me way harder, which I actually liked, honestly. He pushed me way harder beyond belief, and you know, I end up still getting C's in that. So a couple years later, I'm like, okay, now I'm gonna do dental hygiene, or you know, I was getting ready to submit the applications, and I had that C, and I was like, well, there goes my 1C. I got to retake this. So I had to take another math, and it was crazy because I had to go down to like, I think it was, that's what it was. It was topics in math or something like that.
Okay.
Something like that. So I had to go take that many years down the road, and the thing haunted me that whole time. But yeah, it's funny you say that. So keep going, I guess.
Yeah, so, you know, obviously I didn't do too well in my prereqs. Like I passed them just to pass them, you know? So then this is such a funny story, and people always make fun of me when I tell the story, but it's true and it happened. It sounds like a Hallmark or like a Lifetime movie. But I went on vacation with a couple of friends, and to just keep it short and simple, I basically chipped my 2 front teeth right in half, like just right down the middle, like toot. For those who are in the dental field, it's 8 and 9, or just basically your 2 front teeth. And so I remember the moment very vividly. You know, when you pick up your phone and you kind of see that little like reflection off of your phone.
Yeah.
Because my first instinct was to call like my brother, because he was on the trip with me, and I wasn't with him in person at the time. So my first instinct was to pick up my phone and call him. And I remember like looking into that reflection, and my 2 front teeth were just chipped right in half. And so I remember like I freaked out. And
so wait, where were you?
I was in the Bahamas.
Oh man.
Yeah.
Yeah. So you kind of like.
And what were you doing? Were you
We
like
were
ziplining or what?
We were on those little like mopeds, like the little like scooters. We rented those.
So I've heard so many horror stories.
Yeah.
With these things, especially
I
now
know
it's so
now.
popular.
Disaster trap.
Yeah, I know now. They had like faulty brakes. I mean, it's our fault at the end of the day. We were the ones who decided to go on them. I don't know what we were thinking, but you know.
It's a way to get around in those.
Yeah. So faulty brakes didn't break the way that we wanted it to. So I ended up just kind of like catapulting into the ground, obviously, on my front, like on the front of my face. And I just remember in that moment, I didn't know anything about dentistry. I was like, what are my options? Like there was a part of me that was like, I'm just going to have to live like looking like this.
Yeah.
I didn't know at the time what a crown was. I didn't know anything about like what my options were. 'Cause prior to that, the only like dental I've ever experienced was like maybe a couple cleanings and, braces and things like that. Nothing super reconstructive.
Yeah. Just their basics.
Yeah. So I remember like it like completely like destroyed me. I know that sounds really dramatic, but I was like so devastated about how I looked. And in that moment, like I never before even thought about my teeth like that. I never, I didn't realize like the saying, you don't know what you have until it's gone. I mean, I didn't realize that my smile was such a big part of like me and my confidence. And so we got back to the United States, And first thing I did was go to a dentist, and just the whole experience was just awesome. I mean, obviously I have 2 front teeth now.
So I was waiting to say, is that what you asked for Christmas?
Yeah, my 2 front teeth, yeah. And so, yeah, I was like, this is like kind of cool. Like, I was like, that's, I don't know, the whole experience and everything like that. I got to like meet the dentist and meet the assistants. Everybody was so great. And so, you know, I was like still in my junior year of undergrad. So I was like, I'm going to start taking this seriously. Like, I'm going to start looking into this as a field. So it definitely shows in my transcript, because you can see like my grades from there on. All of a sudden just went like skyrocketed, and I did pretty well.
Something.
And yeah, because I had like a vision, I had a path. And so like we were kind of saying earlier though, your grades, it's really easy for them to drop, for your GPA to go down, but it's really hard to bring it back up. And so that's kind of where I'm at right now. I had to take a couple extra classes after I graduated to kind of get my science GPA up and stuff like that. And so that's why I started dental assisting, because I was like, well, before I commit to 4 years of dental school and, you know, all that hundreds of thousands of dollars of debt that comes with it, I was like, let me just really just kind of get my feet wet first in the field and, you know, see if I even like this.
Yeah.
So that's why I enrolled into the dental assisting school, the one that I currently teach at now. Went there, did my externship, worked at an office for a little bit, loved everything about it. So I was like, yep, this definitely like solidified my decision and my choices. When I went back to get my certificates after I finished my externship, the director asked me, you know, she's like, have you ever had any interest of teaching? And I was like, no, I've never taught anything before. I'm not even super comfortable with public speaking at the time, but I was like, let's just do it. I was like, this might be like a fun experience. It might be good on like an application or like a resume. So, and that's basically it. That's where I got to where I am now. So now I teach dental assisting part-time, and then I'm in the process of studying for my DAT and getting into dental school, hopefully.
So do you have any, well, I guess before we go that route, what about like the DET, or is it DET or DEAT? I always say it wrong.
DAT,
DAT.
like DAT.
I always say DET. I don't know why.
Dental admissions test.
Got you. I don't know why. I want to say maybe, I feel like somewhere I've seen dental entrance test.
Oh, yeah. Maybe that exists
maybe that's
too.
why. Anyways, so what's involved with studying for that? Like, how do you, like, is it just like all your prereqs as far as like micro chemistry? Like, what's involved? Is there math? Is there English? Like, what's all on there? Like, what are you studying? How do you preparing for that?
Yeah, so it's about a 5.5 hour test, and it has like 6 subsections. So there's biology, general chemistry, organic chemistry coming back to haunt me again.
Yeah, chemistry was hard for me.
Yeah. Quantitative reasoning, which is math essentially.
Okay.
Reading comprehension, and then perceptual ability, which that one's pretty tough for me as well.
And what does that actually mean? Like,
it's basically they show you like in different ways. They test like your like 3D object like perception, like how to kind of.
I got you.
Okay.
Like shapes and things like that. Like from like a 2D computer screen to be able to like
mentally visualize it like 3D.
Yeah, yeah. It's kind of weird. So that's why that one's tough for me, because I'm not used to it.
There's not really a way to like study that, I guess.
Yeah.
Right?
I mean, there's got to be a way, but yeah, interesting though.
Yeah.
It's so
no
interesting.
previous dental experience. They don't test you on any of that.
No, I think the perceptual ability is the only part that might be somewhat dental related, but everything else is just all those science classes that come back to haunt you.
Interesting.
Yeah, that is interesting. Chemistry is, it's so weird, because that was actually the one class, like, I like numbers a lot, and I was easy to kind of diagnose some of the like formulas and stuff like that, but it was so hard to study, because that is just like, unless you're like being challenged, like somebody's challenging you with like a formula, it's just like you look at a formula or an equation, or however you're plugging it in or using it, it's just like it gets overwhelming. I don't know about chemistry.
And it's not like one of those other sciences that you've taken before. I feel like chemistry is like way out there. I don't even know about organic chemistry. I've just heard from people that class is ridiculously insane.
Yeah, that was one of the classes I had to retake because I didn't do too hot the first time.
Yeah.
So.
Well, that's good that they let you retake it, because I know, like, at least applying for dental hygiene school, they don't allow you to retake classes. You get a grade forgiveness, I think, on one class, but you have to get below a C. So basically, they tell you to fail the class. Like, if you're a borderline C, they tell you just
because getting a C is going to hurt you more than anything.
They won't let you retake it.
Exactly.
Which is so weird, you know?
Like, well, actually, I should reword that, because dental school is kind of the same way. Like, they don't let you retake it, but you can obviously, like, if let's say you got a C the first time, if you get an A the second time, they kind of just average it out to like a B.
Okay.
Yeah.
Okay, that makes sense.
Yeah.
I was gonna say, because I know that was a thing for me where I don't know if I got put. I think it was that math where I was like, man, I was like borderline. Like, I think I had to get like 100 or something, like something crazy on like the final. And I was like, should I just not even show up and just bomb this, or should I attempt it? And I attempted it. And, you know, I couldn't retake it. I knew that, that was like, I remember going through that and looking through all that. That stuff sucks.
Yeah. Grades are tough. So if you're, looking to apply for hygiene school or dental school or anything like that, take our advice now and just really try to keep your grades up, because they're not everything, but it is something that they look at. So it's just important to just try to keep your GPA up as high as you can.
Yeah. And actually, to tie in off of that too, what is there a school that you have in mind that you want to go to or apply to? Because it comes back, like, especially with us, I think we had a conversation, like, you don't have to say the specific school here, like on, like the actual name of the school, but if you want to say like the area, the state, like, are you trying to stay in state for school, or are you trying to go somewhere else? Because I know some people, like, they want to travel to go to school, or there's like a certain school that they're like, yeah, I really want to go here for dental school. Or
yeah, so I know I'm aware that I'm not the most, maybe competitive applicant out there, maybe like metrics wise. So I'm open to going to any school.
Okay.
I do know, like, obviously in-state would be the cheapest route, which, long term would be like the smartest decision. But at the same time, I also would love to travel and experience, living somewhere else for 4 years.
Well, that's what I was gonna say. Some people love that.
Yeah.
Like that's their thing. Like their goal is that. Because I have a friend who's in dental school, and she didn't even apply, and she actually took a transition like master's to a specific school in Florida. But then she decided in that master's program, she's like, no, I want to go abroad. Like, not abroad, but she wants to go outside of the state. That she was like, no, I want to travel. Like, I want to go somewhere else and do it. Because I mean, essentially, also too, like, you talk about the finances, about how expensive dental school is. So it's like you're gonna go in debt regardless. So if you really want to get, maybe, I mean, it's not like you're going to like hang out and vacation the whole time while you're in school. I know that's it's the complete opposite, but she just wanted to practice outside of Florida as well. So she was like, I don't even want to
it's
really
a good way
stay
to
here. She was like,
to kind of test that to where you want to practice. Because if you know that you want to practice out of state.
Yeah.
Yeah, and I think most of the dentists who graduate, they tend to, most of them, not every one of them, but most of them tend to just practice in that state that they graduate from. So, but I'm open to all of it. I just think wherever the road takes me, I'll go there, So I'm excited for it.
Yeah, for sure. It's an exciting, isn't that, like, once you get to that point, you're gonna be like waiting. You're gonna be like, oh, like, where am I gonna go? Where am I gonna end up? Where did I get accepted?
Yeah.
You're gonna be checking your applications, because I know as soon as I got the acceptance like letter for hygiene school, I'm pretty sure I got waitlisted in the school I'm in now, and soon as I got that email, I was like, yes, like, this is it. We're doing it, kind of thing. And it was all in like one day, one night kind of thing. I'm like, yep, mindset. And one of the schools that I really wanted to go to, I stopped even checking all my other emails and stuff like that. And I ended up getting into that school like 2 weeks later, because I think I got on that into that school off a wait list as well. And I was like, shoot, like, I had already committed, like, mentally, like, everything was just, to go there. And just, so it's like one of those things, like, you get really excited and then it just kind of happens. You can just go with it, And I know for you, I mean, I know you said you wanted to stay somewhere around home if you could, right?
Yeah, originally I did, but we mentioned the distractions thing, and it was a nice change up. It was a good change of pace for me.
Yeah, where we are now.
We did.
Yeah, from where we're at now is like no distraction,
Yeah,
kind of in a
no.
way. I mean, no.
There's still distractions.
Yeah,
but,
yeah, for sure. But the other thing I wanted to ask you, Kathy, was what made you choose dental hygiene versus dental, like becoming a dentist? Like, is there a correlation there? I mean, obviously we know the money. Is that like the main thing, or is it, is there something else more there? Like what is your kind of thought process on that?
Yeah, so that's a great question. Yeah, so, I also kind of dived into, hygiene as well, just as far as like research. Like when I worked in the office, I would always ask the doctor questions, but I also asked like the hygienist questions too. And I think, obviously the main, not the main, but one of the biggest things is dentistry is you get to kind of be your own boss in a way, or your own, like you can have like your own like practice. And I know hygienists, they're also their own like practitioners as well. So, but I think with being a dentist specifically, you kind of get to do different things, and you kind of get to choose what you get to do. You get, I think you're more in control of what your day looks like as far as like the various things you get to do. Like hygienists, although it's a great field, what the specific thing for me was that I couldn't see myself doing the same thing every single day.
Yeah.
So, and that's not a bad thing. That's, that's for some people that works, but just for me specifically, I like to be challenged, and I like to do different things throughout the day.
Yeah. Honestly, you kind of definitely like a repetitive thing, obviously, like same thing back and forth. I think there's different ways to make it fun, and I think it's just all depends on the person. That's why I asked, because like for me, like I don't plan on being, because I like doing different things, like you guys know. I mean, I like to keep moving and doing different things, and that's kind of like the one of the things, the object behind like the podcast and everything is to kind of do something else with it and make it more, I guess, entertaining and fun and as well, but I don't plan to be a hygienist till I'm 60 years old, but it's definitely like a gateway maybe to something else, because from a lot of hygienists that I have spoke with, they start in hygiene, they end up going to something else, whether it's sales or teaching or any of that stuff. There's so many different routes, and that's kind of like why I like this side of it. And I don't know, that was kind of like my mindset. So like I do, but there is hygienists I know that they've been practicing for 20, 30 years. Mm-hmm. They love it. I don't know if that's for me, but it's like a weird thing. It's like maybe you do. Maybe I started and I love it. I don't know. It's like one of those things. But I mean, obviously I love dentistry.
Mm-hmm. Yeah, and there was always going to be pros and cons with everything. Like obviously the big con with dental school is that you graduate, with a lot of debt, and that's something that, is very hard to deal with. And then it's a long journey too. Some people don't want to go to school for 4 years, for undergrad, and then 4 years for dental school. And then if they want to specialize, even more than that. So it's a long, hard path. So it's that path in itself is not for everyone. Sometimes you just want to get into the dental field a little bit quicker and work be a hygienist and make a good living, and have some more freedom at work. Because obviously if you're a dentist and you maybe have your own practice,
that was my second thing was the responsibility and the overhead.
Yeah, you're basically running your own business at that point.
Yeah, so that's nonstop. So I mean, it's something that that everybody kind of has to consider. So you just kind of outweigh like the pros and the cons for yourself and what works best for you and your lifestyle that you want. So
like I've seen even in dental school, you'll take classes, like they'll have you taking financing classes, and they'll have you taking whatever, because you have to know not just the dental side aspect of it, but how you're actually going to run that business, because
how
it's
you're
on you.
Too. Yeah. How are you going to not capitalize, but how are you going to get the best of your, your best bang for your buck kind of thing.
So you got to be knowledgeable in a lot of different areas. So that makes sense why you're going to school for so long, because you learn everything.
Yeah.
Tons of stuff.
And it's funny because I'm not going to say exact numbers, but there now, especially like, obviously the economy is doing pretty well, but hygiene pay right now is definitely like obviously the highest it's ever been, but also it's pretty close to starting, like dentists, like when they start and coming out of school, and like it's not, so there's just so many factors, and that's why like I always like to ask, because it just depends on your personal, journey or what you want to do kind of thing in life, or where you see yourself in 5 years, where do you see yourself in 10 years?
Yep.
Like, what do you want to do? And bring it back as far as when you're a dentist or you have your own practice specifically, that doesn't sleep,
Yeah.
especially through the week, maybe on the weekends you get a, break and stuff like that. But, it's just a lot of responsibility. And for me, shout out to my mom, but my mom always just tells me you want to have a job that you can clock in and clock out, and that if you have a business, that's different. But at the same time, that's kind of my mindset. And I like having different, streams of income. And I think that's a good thing to have. But when you have a dental practice, I mean, everything it's all or nothing, kind of thing. And I think that's the mindset, which is a great mindset, because obviously you know how successful and how, much money you can make as a dentist and stuff. So I'm not downplaying it, but it's just everyone's personal opinion.
Yeah, it takes into a lot of different factors for it, and that's why it's good too, because then it kind of evens out the whole field with everything. There's not overpopulation of hygienists, overpopulation of dentists or assistants. It all kind of varies based on what someone wants, so it all balances out well.
Yeah. Well, another question I have for you, Kathy, is what is your biggest hardship getting into dental school? I mean, I'm sure there's probably going to be a little bit more, but what so far, thus far, up to this day, what has been your hardest thing? Whether it's studying, what is it? Is it studying for the DAT, or is it getting the grades? What is your biggest hardship?
Yeah, so kind of like before I was saying, definitely the grades. It's hard for me to bring my GPA back up to something that they see as competitive, because there's way more applicants than there are seats. So that in of itself makes it a very competitive process. So grades definitely, and then obviously the DAT. It's a huge test to study for, and I think the hardest part for me is to try to find time management to, try to find time to study, and also just not go crazy, have that balance.
And are you teaching are you still teaching currently?
I am, yeah. Okay. Just part-time, definitely not full-time, just part-time. So I'm still kind of in the field, but kind of just taking a step back and trying to focus on studying. So.
Well, because I know you had a job that you kind of basically said, I had to cut this out because I need to start focusing on studying, correct?
Yeah. So at one point I actually had 3 jobs, because I was assisting 2 days a week part-time. I was also teaching part-time, nights and weekends. And then somewhere in between that, I was also working at a restaurant, just serving, hospitality. So I had to let go of some of those things to make time for studying, because I would come home every day and I'd be too tired, and I didn't want to study. I just wanted to go to sleep. So I quit my serving job, and then I also quit the assisting job, and just kind of focused more on teaching, because I felt from a applicant standpoint, I don't hear about too many applicants being teachers versus being dental assistants. So although I do know I'm kind of missing more on the clinical side, I think it's something that makes me stand out a little bit, because every time I bring it up, people always ask me oh, you teach dental assisting? It's something that talking to fellow peers, not a lot of them do. So I'm trying to hold on to that, because I feel that's something that makes me stand out.
Yeah, for sure. And I learned, when I was teaching, I learned so much, even about myself, even enunciating or is it enunciating or enunciating, certain words that I'm very much a quiet, shy person at first when you first meet me. And then, after a little bit, I get to know you. I don't stop talking, obviously. I probably have stopped talking today. But, that's one of those things that helped at so much, and just from a professional standpoint, it's going to help you long term, even if it's not necessarily on paper that it looks, as good, but it's going to help you with so many other things that I feel such a great experience. I'm so glad that I was blessed to be in that. And I actually fell in love with it. I really did. I had a good passion for, that at first. And it was a little bit weird. Even the first time it was a little bit weird, but I really did like that. But
and even your public speaking, I'm sure that's changed a lot.
Yeah. Definitely with teaching, kind of with Greg, I wasn't too comfortable just talking in front of a crowd. But now I'm okay, because I do it so much now. So I've definitely practice my speech, practice my enunciation. You know, I know how to like interact with students and, you know, answer questions that they have and things like that, which one day I'll have to do with patients, right? Like patient education, kind of breaking down like dental terms for, you know, the students or the patients one day. And then it's a very rewarding career because I still get to do dentistry and I still get to talk about dentistry every single day. But it's cool to, you know, maybe like inspire my students or, you know, help them on their little dental journey as well. 'Cause some of them, you know, they want to be assistants. Some of them, you know, want to get into hygiene school. Like they're just getting started. So it's cool to kind of be a part of their journey.
You see 20, 30 of those journeys going on through a year. And then after those next ones, here comes a new group coming in.
Yeah.
You get to see a lot with it.
And you see a lot of different people and stuff like that. And that's like, even like, you know, now we have clinic and stuff and, you know, the past like year or so, that's been an interesting thing that I think has helped a lot, you know, as far as like one, like being an assistant and being able to like understand like so many different people as far as, you know, whether it's ethnicity, you know, and anything. I mean, it could be so many different factors that you have to take into consideration as far as like how you're going to connect with them. How are you going to educate them? How are you going to, there's so many different things that it's really like a personable job. And, you know, I think actually I want to say we all have some form of customer service behind us before this, which I think is a great thing because that's a big part of it. And you don't realize that too much until you're really like kind of put in the hot seat. Like I know for sure, like the first day I was like in an office or had my own patient, I'm like, like, what do I talk about now? How do I connect? And then, you know, then usually obviously a topic gets brought up, you know, about their specific journey that you kind of connect with them about as far as their dental treatment or something. But you got to connect with them outside of that to get them to understand that, you know, like there's so many different ways to correlate that.
Yeah, I know. I thought about that a lot with my first patient. I had way overthought that about what was I going to say? What are we going to talk about? I like that little gap of just quietness with us after they sat down in the chair felt like minutes, and I was just way too much overthought it. And then now it's like, okay, it's not a big deal at all. You just pick something. Even like I remember when I was in school, whether something that they're wearing, if they're wearing a hat, they're wearing a shirt, bring up anything.
And it's funny because there is some people too that they don't like the small talk. You know, and they'll tell you that, which is okay. You know, if you're there strictly because, you know, whatever, like that's fine too.
Exactly.
Like there's so many different things. And I know Cody has mentioned it before to me because I have a patient, you know, I won't go into too, you know, much detail, but I have a patient and he's like, dude, you're like buddy with this patient. I'm like, because that makes them feel comfortable. And his specific, you know, like I can't talk too much about it, but you know, he doesn't love being there, you know, and he finds that connection with me, and now it makes everything a little bit easier for him, you know, and he trusts me, he believes me in that stuff, which is great because one, I'm still a student, I'm still learning, you know, but to have that and break that, it's just so important, I feel like. So I think all of our, you know, backgrounds, our journeys are all kind of like leading into the right way of, I feel like the right way.
Yeah, I would say so.
Yeah,
Dentistry.
I think this is what I always preach to my students, you know, like when they're, because we help them write their resumes to apply for their externships or jobs. And they're always like, well, I did this, or I worked in a restaurant. How am I supposed to, why would they hire me if I don't have any prior dental experience? And I'm like, what do you mean? Like that, every experience that you have, there's always going to be something that you can like learn from it, or like that could, you know, turn into like a skill or something that you can contribute to, you know, that office. So every experience, you can always turn it into something positive. And, you know, whether it's a mistake, if you make a mistake, you learn from it. There's always something positive that can come out of it.
For sure.
That's a good point. I like that.
Yeah. See, look, she's a good teacher, right? But yeah, I guess, you know, we hit on a lot of good things today, Kathy. You know, I think it's probably time to go in our little segment. So before we intro the segment, I want to ask you, Kathy, because obviously you want to go to dental school, you want to become a doctor and a practitioner. And what is your knowledge, I guess, in basically like pharmacology, like medications? Like what is...
goodness.
Have you looked into that? Because that's going to be a big part of, like, we've taken pharmacology. For us, we're not, you know, we're not allowed to prescribe anything or anything like that, but we basically have to understand everything when it comes to medical history and understanding each medication. And that's a big part of our, you know, board test to get licensed.
Yeah.
So I kind of, that's the gist of our, segment today, so that
Okay.
way it kind of ties into you. Maybe you'll learn something too.
Definitely
so.
will learn a couple things.
She's gonna be in school and be like, "Oh, I remember Greg
Yeah.
talking about
Yeah,
this."
I remember this podcast.
Yep.
All right,
All right,
so
let's
go
do
ahead,
it.
roll it.
Dental terms 102.
All right, so it's not going to be a specific word today. It's going to be kind of a topic / word in a way. So
Okay.
we're just going to basically touch on the schedules of drugs, like the classification schedule of drugs. So there's different, obviously, drugs that fall into different schedule, you know, as far as what class they're in. So I'm going to obviously kind of hand this to Cody a little bit and just tell me what you know. It can be anything basic. It doesn't have to be a specific. I mean, how many classes are there? Let's start with that. Do you remember that?
I want to say 5.
Correct.
And then, okay, so kind of side topic here. I think codeine has its own specific. Is that right?
Correct. It's part of the 5.
Okay, but I thought there was one just based with, or maybe it's because like, oh, this one contains codeine. It's this
Correct.
type of schedule. Okay.
Yeah. So you got
All
it.
right, so there's 5 schedules.
So there's 5 schedules. What is there an order or anything that kind of plays a factor? Do you remember that?
Yeah, I know. Well, one's most severe and all the way down to least severe. Like,
Okay. Exactly.
The first one is the most addictive, or is it the ones that are used based on usage? I guess that's kind of if it's very addictive, it's not going to be used. So that I think is Schedule 1.
Correct.
And what drugs
that's exactly
fall
what
into that?
you didn't say it the way that I have it, you know, memorized,
Okay.
but it's basically the higher the number of drug, like the class through 5, the more potential for abuse.
Okay.
So that's how I remember it, and that's how I've studied it. So the higher the class, the more potential for abuse.
And then they just go down from there. Okay.
which is a little bit, you know, and like I said, correct me if I'm wrong, but this is what I got from my studying.
Well, what's one? I'm trying to think of an example of
All right,
what would
so-
be the most addictive. Do you know one?
Oh God, I don't.
What's the highest? What's the most addictive? Meth. It's methamphetamine.
Yeah, it's amphetamines.
amphetamines.
That is correct. That's actually not 1 though.
Whoa.
That's 2. So I'll let me run through
I
it.
should know
So,
1.
1 is the highest, so that's going to be the most potential for
Yeah.
abuse, which I
Cocaine.
That was gonna be my next guess.
That might or might not. I
right, go ahead,
don't
go
have
ahead.
it written
I'll
down
let
on
you-
that specific one. No, I'm glad you brought it up because I do have a picture of that I'm going to correlate in a second. But from what I have from our study books and stuff like that, which I know that this has popped up on somewhere. I don't know if it was our test, one of our something, but where marijuana stands in, which is 1, because it's not in. I think it's not in our book or something. But marijuana is a Schedule 1 drug, which is weird.
Okay.
But it's also heroin, LSD.
Heroin. That's what I was looking for.
Heroin, LSD is Schedule 1. Schedule 2 is opioids or opiates, and that is oxycodone, morphine, hydrocodone, and then also the ADHD medications.
Okay.
So things like
Adderall.
Yep, you got it. Yeah, you got it. Adderall, Concerta, which is another one, and I'm not going to try to say this last one, but it's Ritalin.
Oh, Ritalin.
Ritalin. There you go. I'm so bad with.
I remember.
I just said I got better at
Our
enunciating,
teacher
and then I
is
can't
just
enunciate.
popping up in my brain during every time you say one of these words.
See, but that's why we like to do this segment. But Schedule 3 is codeine. It's one of the codeines. It's Tylenol 3.
Okay.
Schedule 4 is anti-anxiety medications. You know any?
Barbiturates.
Okay, good.
Oh, wow.
Studying over break. I studied pharm.
Yeah.
Barbiturates and what's the other one?
Xanax?
No. I'm not gonna say. I don't know what that is. I'm not gonna say that.
Is Xanax?
Correct.
Yeah.
Anti-anxiety. So you got Xanax, Valium, and Versed.
Okay.
And you know, Versed is, I always remember it. It's a common drug that they use in IVs for conscious sedation.
Oh, okay.
So I don't know if there's an actual pill form of that. I'm not sure, but I know that there's a liquid form that they use for conscious sedation, Versed. And then there's also sleeping medications. So things like Ativan, Ambien, Lunesta, I don't know if I'm saying that, and Tramadol.
I remember seeing commercials for all those. They show like a
I know the
butterfly.
Lunesta,
this little butterfly flying around. I
So
always
it's
remember
Schedule
that one.
4.
Okay.
I don't know how we're going to remember butterflies in 4, but
they have 4. Well, they have 2 wings, but it looks like 4.
yeah.
Okay.
Yeah.
And then the last one is going to be Schedule 5, and that's your codeine cough syrups.
So that's all right.
So that's how I wanted to. So schedules. So 1 is the highest, which is marijuana, LSD, and heroin. So that's the most potential for abuse.
Okay.
Cool.
All right.
That was a good one.
You like that
I'm
one?
glad you went back to farm even after I pulled it out on you last time.
You did, and that's why I feel like this was a good one because you're going to be a doctor someday, so you're going to probably educate us more,
Yes.
in
I'll get back
detail
to you
later.
on that.
But I felt like it was a good, kind of correlated to the episode with you,
Yeah.
and maybe you learned something there too because there's so many drugs you have no idea. When this pharmacology, I don't know about for you, but for pharmacology for me was the hardest topic. Like,
Yeah.
I mean, subject in school.
Yeah, there's just so many different complicated names too. Like
endless, which is crazy. And and the other thing is too, like even like listening to different study, like all the new ones, like they sometimes throw new ones into our boards. Like they're like, oh, what's this new one that just
it's always
started?
changing. New drugs are hitting the market.
Yeah, what's a new one hitting it? So, anyways, that was our segment for today. I guess we can kind of wrap up this episode. First and foremost, thank you, Kathy.
Thank
Yes,
you so
thanks
much
for coming
having
on.
me. It was
Yeah.
a pleasure.
For sure. And make sure you guys are following us. If you're listening to YouTube, subscribe to us. Definitely hit the like button. If you're listening to the video, please hit the like button. It helps us. It helps the algorithm. If you're listening on Spotify, make sure you're following us on Instagram. And yeah, other than that, I think that's about it.
I think that's it. Stay tuned for our next episode. We're going to have some good stuff coming.
Oh, yeah. Let's do it.
All right.
We'll wrap it up.
Why do we do it?
Because teeth.